working really badly.
Starting today, most referral hospitals will be missing a critical workforce, intern doctors, who do most of the ward rounds and many of the tasks on behalf of established doctors.
We shall need to be paid that 24 billion effective immediately.
Statistics at the Federation of Uganda Medical Interns show that there are 1,403 medical interns spread across 42 medical facilities, which include national referral hospitals, regional referral hospitals, and private not-for-profit facilities. Mulago National Referral Hospital, for example, has over 130 of them. Each financial year, Finance releases 11.4 billion shillings for their allowances, and each gets 750,000 shillings per month.
To work 36 hours.
Last year, they pushed for an additional 24 billion shillings to be added to their allocations. This would see each of them get at least 3 million shillings per month. The push was followed by a petition to the Speaker of Parliament and a discussion on the floor of the House. However, after waiting for this to come through, the medical interns said they had had enough.
And we anonymously agreed to let down our tools starting today until issues concerning our pay are addressed. This is because we cannot put up with the poor working conditions anymore. Cries have been made in the past, and the more we prolong, it seems like we are comfortable. But with the different injuries, the different harassments, the disrespect people are getting in the hospitals because they are extorting is rendering our professions meaningless in these hospitals. So it's very impossible for us, the carers, to be taking care of the patients when we are not cared for or when we are not in the right state and our welfare is not being addressed.
They know there are consequences for their actions, but they think it's better.
We know that the consequences can be there, but we request that this time round, instead of putting those consequences to the leaders of interns, they actually sit and bring the responsible bodies, Minister of Finance and President, to address the actual cause of the discomfort and distress among the medical interns.
Health Ministry spokesperson Emmanuel Inebiona says responsible government ministries are already discussing the matter and urge them to exercise patience until the matter is resolved, instead of abandoning work at a critical time.
At the moment, we do not have the funds required to meet their demands in the current financial year. This calls for patience, and we appeal to them to go back to work and attend to patients, given that we are on the foot of a resurgence for COVID.
Inebiona adds that he hopes government's plan to restructure several state agencies will avail funds to narrow the remuneration gap, which is a major reason behind intermittent industrial actions in the ministry. Edward Mhumza, NTV.
No, because